All right, so here we go. Torticollis. All right, so first we're just going to go into what torticollis is. It is basically a condition that is a tightening of the neck muscles, and it causes difficulty in anybody, babies, adults as well, turning their head side to side. What it will also do is, so difficulty turning side to side, they'll be stuck turned to one side, they'll also be slightly tilted to the opposite direction. The main muscle that is affected is called the sternocleidomastoid muscle. That's this muscle here in front that everybody has, also known as SCM. It's a little bit easier to call it the SCM than that long word. So what that muscle specifically does is it turns. So if you turn your head to the left, that muscle on the right is the one that's working. So it turns that head to the left, but it will also tilt to the opposite direction. So when somebody has torticollis, most of the time they will be stuck in that turned and tilted position, and it could be either side. Now, there are other neck muscles that are affected. Another one that is mainly affected is called the upper trapezius, or the upper trap. Now, the trapezius muscle is a very large muscle that is broken up into three different areas. The upper trap, which goes from the base of the skull and out to the shoulder. You can imagine that muscle, which is a neck stabilizing muscle, will also become tight when a person, baby, adult, or otherwise, is turned and tilted to one side. All right, so this condition specifically makes it difficult or even impossible for a baby to turn their head to both sides evenly. They may be able to turn slightly to one side and all the way to another side. The baby will not be able to rotate side to side evenly or at all. Now, as an adult, think about how many times a day you turn your head. How difficult would it be if you were not able to turn your head to do certain activities? Driving, walking up and down the aisle at a grocery store trying to get your groceries, exercising, or any other job that you may have. So who does it affect? Most of the time, I myself will see, of course, infants or newborns. It can affect adults, but that happens in various other reasons. And obviously, as a pediatric physical therapist, I see mostly those babies. I have seen as young as 2 weeks old for this condition, and usually up to about a year old. At that point, if they're coming in for it, we do usually have them better by that year mark. And I personally have never seen a child or somebody older than a year old with this condition, even though it can happen. All right, so how does it happen? There are two different categories for how torticollis can happen. The categories are called congenital and acquired. Congenital, meaning present at birth. So obviously, congenital, they can be born with it. This can be how they are positioned in the womb, and it is especially common in twins and other multiple births. So imagine there is such little space in the womb to begin with that they're not going to be able to turn side to side. And it's even going to be less space and less room for them to move if there are multiple births going on. So it can happen also during the birthing process. The baby can get stuck in the birth canal. And the neck is overly stretched during that birthing process, meaning also the head comes out, shoulder gets stuck in the pelvis, not able to come out. So doctor, everybody else trying to pull it out, stretches it a little too much and causes a slight damage to that muscle. It happens that way too. We can fix that as well. Now, when that happens, during the birthing process, they can also have damage to their nerves as well, which can cause a little bit more issue, but nothing that can't be fixed. So those are the congenital ways of how torticollis can happen. The next grouping is called acquired. These acquired, meaning acquired during their lifetime, so happened after their birth. This is the most common that we see in the clinic. It usually happens because a baby, infant, newborn, prefers to just look to one side. Now, I will tell you from experience, not just working with kids, but my children as well, both of them prefer to look to one side. Obviously, as a physical therapist working in the pediatric population, I was able to help them and prevent this from happening, but that's how it is. Babies prefer to look to one side. And most of the time, if they are nursing, being breastfed, it is usually, they also prefer to latch just on one side. That is the side that they prefer to turn to. That is the side that they start to get the issue on. Yes, so that is the acquired way of how this happens. It happens during their lifetime after they are born. All right, so what will happen if this torticollis goes untreated? So if not treated, it can lead to something called plagiocephaly or flathead syndrome. So if the baby's head is constantly turned to one side all day, every day, a flat spot begins to appear on that side that they are turned to. Now, I don't know if you can see, but hopefully with this picture down below, you can see on the left side a normal head shape of an infant newborn. And on the right, you will see the flat spot forming on the side of the head. Now, the flat spot doesn't only affect the back of the head where they are putting that pressure when they are turned. It also causes a malformation in the front as well. You can see in this picture that they've got the flat spot in the back and a slight bulging in the front of the skull. So the side of the flat spot will also depend on the side the child turns their head. So if they turn their head to the left, the pressure is going to be on the left side on the back there, and that is the spot that will have the flat spot, and vice versa. They turn their head to the right, that's the spot that they will have that flat spot there. So I myself have seen flat spots on the right and on the left. It happens both ways. There's not usually one that occurs more often in babies and infants than the other one. But it can also happen on the very back, just straight back, a flat spot there. In those instances, when it's just straight back flat, the baby doesn't want to turn their head to either direction. So this can mean the muscles are tight on actually both sides. So we kind of would have to work both sides there. So at this point, if they do have a flat spot, depending on the severity of the flat spot, the baby may require helmet therapy. Now, as a physical therapist, I myself, or even a PTA, a physical therapy assistant, we cannot determine whether a helmet therapy is necessary or needed. That would be up to the pediatrician or an orthopedic surgeon, orthopedist, somebody else like that. So I can't tell you if it's required or not. I can, and I have made suggestions or even referred a family with a baby with torticollis or that plagiocephaly to an orthopedist or back to their pediatrician saying, hey, maybe we should look into doing this. But again, I can't just say, oh yeah, go here, get yourself a helmet. You're going to need it. So here are some examples of those helmets that can be used. So as you can see in the bottom picture, this child has a full cover of the helmet, most likely meaning that they had a slightly larger deformity than what others have, compared to the one in the top, where it's just part. As you can see, it's more on the right side of this child's head that the deformity is happening, so they put it more there. Now, I've also come across some that where the helmet will actually come down and it has a part on their cheek where they have that bulge, like I showed you on that picture before, the flat spot, and then kind of coming forward with that bulge. They will have parts on their cheek, maybe down lower on their forehead or up even higher. It just depends on what that child needs. And how long they need to wear it will also depend on what the child needs, how well they respond to the helmet therapy. And the helmets usually weigh around 6 to 8 ounces, not even a full pound, about half a pound. Now, considering in retrospect, that is not very heavy, but to a baby who is trying to learn how to lift their head and train their neck muscles, this can be substantial. And the baby usually continues to attend physical therapy afterwards as well. And with that, we help make sure that they are again, turning their head side to side and meeting the milestones because of that extra weight that they have on them. So other issues associated with torticollis, it can lead to other developmental delays that the child achieves. The inability to turn their head evenly and easily to each side can lead to the inability to roll over or sit up independently. And the inability to roll over and sit up and even hold their head up properly as well. If they can't do that, obviously they're not going to be able to have the core strength in their muscles that they need to eventually be able to scoot, to walk, to crawl. So doing these with the torticollis, with that extra weight, with the inability to turn their head, it can lead to more developmental delays down the road. So some tips to avoid torticollis, and these are what I usually will tell patients and parents mostly, not necessarily the babies, when they come in for that first initial evaluation, is the first thing is to try to get them to eat on the opposite side, latch on the opposite side if they're breastfeeding. If they are breastfeeding and it's hard to get latched on the opposite side, once or twice a day, if possible, try to feed them with a bottle and feed them with their head turned to the opposite side. Now, if they're already eating from a bottle, perfect, do that same thing. If they're starting to eat solid foods, awesome, have them turned, come at them at a different angle, trying to get them to turn their head. Another thing to remember is the car seat. Most of the time, the kids like to kind of just tilt their head or drop their head over to the side. Easiest way, roll up a blanket, a towel, something small, and put that next to the head to turn them into the opposite direction. Now, the picture that I have here has a baby who has blankets on either side of their head to keep them straight. That is also possible. Definitely something to do if they haven't yet developed it, just to keep them focusing straight ahead. If they do turn, say they turn to the right side, you roll up that towel, put it there. Mainly what it's going to do is keep them from being able to turn back to that side. They may not turn completely left, but they'll at least not be turned to that right side. So you can also purchase those like neck pillow devices at any store that has baby equipment. That will also help, definitely a possibility. Those can be expensive. Around more than $30 sometimes, and some people like myself, I wasn't really willing to spend that much money on something that a rolled up towel or blanket will do just as well. All right, some more tips. So when laying the baby down to sleep at night or during nap time even, lay them on their back and have them immediately rotate their head to that opposite direction. Then leave them. If they turn back in the middle of the night, it's fine. Let them sleep and get some sleep yourself, especially if they're still waking up in the middle of the night. Excuse me. So, and the last thing you want to do, obviously, is risk waking them up in the middle of the night if you don't have to. If they do turn back the way they prefer to turn, okay, leave them. You don't want to wake them up. You don't want to make them fussy. Do it once, turn that opposite direction. Or if they are waking up in the middle of the night to feed to whatever reason that babies do, every time you do lay them down, go ahead and turn them to that opposite direction. But don't wake up yourself, just to make sure that they're turned in that side while they are sleeping. All right. The most important thing to do to help avoid torticollis, please excuse me, is tummy time. As soon as possible, the most important. And this isn't just for torticollis, it's also for all development that babies need to have. So you can perform tummy time with them on your chest, over your knee, over a pillow. Those boppy pillows, nursing pillows are excellent for this. And then completely on their tummy. Tummy time on your chest usually happens if you're just holding them and before their umbilical cord completely falls off within those first 2 weeks. Yes, that is when you want to start it, soon, within those first couple of weeks. And that's how you want to start, is on your chest, and then transition to the other ones. On your chest, over your knee, over the pillow, and then completely on their stomach as they start to be able to tolerate it more. This helps them to learn to turn side to side and increase their core strength and neck strength so that they can eventually, once they need to, reach those milestones. So in tummy time, whether they are on your chest, over your knee, over the pillow, or completely on their stomach, you want to put the toys, all toys, light up toys, toys that make sound, any kind of toy that they will be reaching for or looking at, put them on the opposite side. Put those toys over there. So if they turn left, they want to turn left, put the toys on the right side so that they have to actively start to turn their head and get to that point where they're looking at those toys. And then vice versa, if they're looking right, put them on the left side. All right, so tracking toys. So tracking is following with their eyes. They're going to, using light up toys or toys that create noise, make them follow through that full range of motion in their head. Make them look completely left, make them look completely right. Make them turn their head. And this can be done, like the pictures show here, when they're laying on their back, turning side to side, when they're sitting up, so you can hold them while they're sitting just in front of you, sitting up like this baby is in the picture independently by themselves, or in tummy time. So it definitely engages, it gets you engaged with your child, it gets them turning their head side to side, it gets them to start using those muscles the way they need to. All right. Another thing I will also do every time a patient comes in for that initial evaluation is give them stretches to perform at home. These pictures have basic stretches that I will give to everybody. So this first picture up on the left side, tilting that baby's head to the side. So if the child turns and tilts to the right, turns to the left, tilts to the right, so you're going to want to tilt them to the opposite direction. And you can see in the picture that the adult has their hand on the shoulder to hold that down. If you just start to do this, most babies will just start to come and do kind of that motion where they bring their shoulder with them. So they're not getting that stretch that they need. Hold the shoulder down, stretch them to the opposite side, and you can do that both sides. That will help them. All right. The next one on the right side, this is a cradle hold. Most babies prefer to be held. This is a good way to do it if they don't want you to stretch them. They're just being a little too fussy that day. This hold, you're going to want to just put your arm in that crook of their neck. And you can see in this picture that with that arm there, they're just slightly tilting to that side. It doesn't have to be drastic. You're just going to slightly stretch it to that side, opening up the space that those muscles need. Next, turning. So with this one, the top picture, again, you can see that the adult is holding down that shoulder and turning to the opposite direction. You don't want that shoulder to come up. You don't want that body to turn with it when you turn that head. Another thing to remember with a couple of these stretches is, yes, they're fragile, but they're not as fragile as you may think they are. They can tolerate being stretched a little bit. So even if they do get fussy, keep trying to get them to turn. Keep working at it with them. Another way that most babies do usually prefer earlier on is this bottom picture. Cradled against the parent's chest, have them turn to the opposite side. Let them nap that way if you want to, if you feel like holding them. If it's only for a few minutes, an hour, whatever, you can hold them there, let them just relax, let them be stretched to that area. It'll definitely help them. They may feel more comfortable with it, especially if you're working with somebody who's just a few weeks old and not really ready to be stretched too much. All right, next. All right, so something that is most important to remember is acquired torticollis, that one that happens after birth. Happens to many newborns and infants, but it is very preventable. You can prevent it from happening, from it getting worse, as long as you do some of those things that were suggested. Get that neck pillow, start feeding them, making sure they're going side to side, start tummy time, get them tracking those toys. Congenital torticollis, where maybe not preventable, is treatable. I have treated that. We see those babies a lot as well. So we do get those ones back to normal just as well as we do the acquired torticollis babies. It does not just happen with physical therapy. Yes, it does. Physical therapy is a big part of it, but parents, you need to take an active role in helping to treat your child if they start to develop any kind of rotational bias, if they start to get that torticollis. It is very important for us as parents to take that time with them to make sure that this just doesn't happen for them, so that they don't need further medical attention from a therapist, from an orthopedist, getting that helmet later on down the road. And please understand that these are just tips, and stretches are just an overview. These are the first ones that I would give a parent as they come in for that initial evaluation. But we as PTs, the PTAs that we have, will also perform other exercises. There are other things that we can do to help. If you're noticing that your child just isn't responding as well to the ones that you are doing, to the ones that we give you to do at home, we have other tips and tricks that we can do, that we can pull out of our hat and get them back. But these ones that we give you, again, they're just a foundation, but they are a good foundation. If you stick with those, most of the time you're not going to have an issue with that torticollis occurring, reoccurring, or getting any worse.
What are you guys doing in the microwave? You should be subscribing to our YouTube channel. Go, now!